you guys have any questions? We discussed a lot of different things. Okay, I renew my availability. You have my email hopefully by now. It's marsella@ufl.edu. If you have cases, questions, just please save it and send me an email, okay? And the same is if anybody is interested to come and visit in the States at the University of Florida and do a period of externship, to kind of increase exposure to cases and knowledge and so on, I'll be happy to help. That can become eventually generalized. So I don't see anything on the screen here. You guys need to give me this, okay, so that I don't turn around all the time. Okay, so the first thing that I ask myself when I evaluate these cases is whether this is something that has developed over time or is a congenital issue, right? So there are some animals are just born hairless, either by mutation or because of a certain breed. So that's the first classification. So I'm going to talk about a little bit about those, and then I'm going to talk about acquired alopecia. And so the first question as a clinician I'm going to ask myself is this self-inflicted? So it's secondary to pruritus. And so again, it is important to work up these cases for pruritus, like we discussed yesterday. Or the hair is spontaneously falling out. And so it's not that the animal is pulling it, it's coming out. And so the options how the hair falls out is, one is folliculitis, so there is a process that is affecting the hair itself, or there is something that is interfering with the hair cycle, and hormones have that ability, so endocrine diseases are the classic example for that. Or there is some dysplasia in the hair follicle, and those are diseases that run in specific breeds. So I'm going to cover examples of those things. So let's start with the congenital alopecia. So alopecia universalis that we have it in animals, but it occurs also in people. And then so basically you're completely hairless, but you can also have hypotrichosis, which means you have less hair or no hair in specific areas of the body. So there are some breeds that have been selected to be hairless and believed to be hypoallergenic. So for people that have allergies, for example, to cats, that's one of the breed at times that people kind of tend to select, and so this is genetically inherited trait. And the same is for dogs, right? So these dogs are congenitally hairless. Now, many of these dogs also develop comedones. That's very important. So it's important to protect them from UV exposure. They get a lot of sun damage if they don't have some form of clothing to protect them from sunlight. And comedones are very frequent in this breed. So we would have to, when we bathe them, we would have to use products that have a follicular flushing activity. So one of the ingredients, for example, is benzoyl peroxide that kind of helps to release all this keratin material from the hair, so the hair follicle, so that it doesn't get plugged. Okay, so these are just genetically selected to be like this. But then you can have individuals that are just basically born with areas of the body where the hair is just simply not there. Sometimes they have miniaturized hair follicles, so like if you were to take a biopsy, you still see hair follicles, but they're much smaller. And some animals is completely absent. Okay, and that again is a genetically inherited trait, and nothing that can be done, and it can be, large areas of the body or just like little patches, not because there's any inflammatory process going on. It is just like they are just born like that. And so again, like these are just examples of cases that have been reported in the literature where you can have some siblings that have this trait, And so it's, it's thought to be a recessive trait. And so they're just obviously not to be used for breeding. Now, another category is the acquired alopecia. So we're going to spend the rest of the time talking about diseases for which the hair basically is lost. And so one thing is very important to establish what is self-inflicted. And I think that's not so much for dogs, but particularly for cats, because cats can be secretive groomers, so people may not have an awareness that the animal is actually pulling out the hair. And some cats actually do that in a way that the skin itself is not damaged. They just simply pluck all the hair. And so one way to find out, it may not be just to ask the owner, but to examine the tip of the hair to see if the tip of the hair is broken or not. And if it's not broken, it's important to establish the life stage of the hair to see if it's in a growing stage versus a resting stage. So another thing is when the hair comes out easily. If I examine my patient and I just get big clumps of hair, that is a sign of folliculitis. And so we talked about 3 causes of folliculitis, which is Staphylococcus, Demodex, and dermatophytes. Or you can have animals that are all in telogen phase, so this hair kind of epilates easily. And so we think about endocrine diseases. And we already learned quite a bit about hypothyroidism and Cushing in the last couple of days. We talked a little bit more this morning. But these are examples of trichograms where you can see the broken tips versus the normal tapered hair. And this is just to have an idea of how much the animal is playing a role in inducing this alopecia. And then I'm going to show you some examples. So these cats were presented basically for symmetrical alopecia, but this was all self-inflicted. All these cats that I'm going to show you are basically flea allergic, but they did not have the eosinophilic granuloma, they didn't have the plaques or anything like that. The skin was beautiful, they were just plucking their hair. Okay, and so obviously, depending on how agile they are, they can kind of reach all the way to the back, or they can just focus on the belly if they're a little bit on the heavy side. But basically, this was all self-inflicted, and it was not psychogenic. It just responded to good flea control. And so I encourage you to consider these cats and provide effective flea control. And I think it's critical to explain to people that fleas are not just the one you see on the animals. Most of the time, you will not see fleas on these individuals because they're grooming a lot. So, just the absence of flea dirt and fleas does not rule out flea allergy. Matter of fact, the majority of the fleas are in the immature stage, in the environment, in the carpet. So it's important to kind of educate people to do some form of environmental flea control and explain that having fleas in the environment has nothing to do with being dirty. I mean, that's kind of like something that is a loaded topic for many of my owners. They're resistant to accept the concept that the animal has a flea allergy. They would take anything else. Food allergy is more trendy, or some other disease. You can see this also with Demodex gatoi. So cats have 2 types of Demodex, right? So there is cati, which is the follicular one, and then gatoi. And gatoi is the superficial one, the kind of short and fat, and so it kind of is contagious, is pruritic, and many of these cats self-groom excessively. So when you are presented with a case like this, and your trichogram says you have broken tips, do your scraping or prescribe a product that will address these mites, like, for example, Bravecto, just to make an example. Okay, so if I am dealing with acquired alopecia, the first thing to do is to rule out folliculitis. Although most cases of follicularis have multifocal alopecia as opposed to this uniform symmetric pattern, it's good due process to make sure that you're not missing that. Now, if you have ruled that out, then you are considered at this point diseases in which the hair cycle itself is disrupted or there is some form of inherited dysplasia. Okay, so let's take a look about various diseases. Well, I'm going to start with endocrinopathies. And you have already learned all the good and bad and the ugly about the various tests that are available. So I'm just going to clinically compare hypothyroidism with Cushing. So there are obviously different clinical signs, the dog that has decreased activity versus the one that is PUPD. But skin-wise, let's focus on that. They both can develop symmetric alopecia. So truncal alopecia that will spare the head and the extremities. So those things are in common. The Cushing dog will have a thinner skin, so typically it's easier to see the blood vessels. They both may have comedones. They both may have scaling. They may have a secondary pyoderma component. The skin of the hypothyroid dog may be thicker, either normal or sometimes thicker than normal if they have mucinosis. And the hypothyroid dog may have the rat tail, okay? And the Cushing dog may have calcinosis cutis. So they have differences and similarities. So the similarities is the symmetric alopecia, the head, the spares, the head, and the extremities. So let's take a look at some clinical cases. So this is Maggie. Maggie was diagnosed with hypothyroidism, and she has a bit of a tragic face. And she had that rat tail. So the alopecia on the tail was not self-inflicted. It was just simply falling out spontaneously. Okay? And so, again, when we consider cases in the clinics and we have dogs that keep coming back, let's say with recurrent infections, we always think of infections as a secondary issue, right? Pyoderma, we said, is always secondary. And so we divide it, once we take away the pyoderma, we look for the underlying disease. And they're typically divided in itchy versus non-itchy. So in the itchy categories, you have the allergies and the parasites. In the non-itchy category, you have endocrinopathy. So hypothyroidism is one of the underlying diseases that can be responsible for recurrent skin infection that it would be otherwise non-pruritic. So typically are middle-aged animals, and again, it's like the head and the extremities are spared, and just they develop this truncal alopecia. As Dr. Torres highlighted, I totally agree, hypothyroidism is overdiagnosed because this test is affected by many different factors. I'm not going to get into this, we'll learn all that. What I would like to focus is more on the clinical signs. So they can have seborrhea, so they may just have alopecia, or they may have like some crusting and scaling. They may have hyperpigmentation, and they may also have other manifestations like recurrent ear infections. Okay? Hypothyroidism typically runs in larger breed dogs. So if I kind of like look at a dog that is presented with symmetric alopecia, in my head, I think your large breed dog, I'm going to kind of make sure that I take a close look at hypothyroidism. But if you're a small breed dog, and I may be more likely to look for Cushing because there are some breeds that are more prone to that. That obviously has exceptions, but this is how I kind of rank it in my head. But Dobies are prone to hypothyroidism, and so that's certainly something that we want to consider. Dachshunds do that too. So this little girl came to us, and so, the complaint was, she was getting chubby, which doesn't take much to make a dachshund fat, but she had decreased activity, and the coat was kind of like starting to bleach and get thinner. And so she was actually, I think, one of the few cases that you can see that you say, yeah, I think I got this one. I think it's going to be hypothyroid, and you don't have to kind of like stress too much about the interpretation of this test. And then I showed you this the other day. So some dogs, basically just the coat is bleached, and they may hang on to that coat until they eventually lose it. And the first area where they lose it is typically areas where there is friction, like, on the ventral neck. We talked about the hyperpigmentation on the bridge of the nose. Not every hypothyroid dog develops that, but when you do see that, that is pretty much a sign of hypothyroidism. So it's something like the rat tail. So they're kind of like things that make it easier for us to have a diagnosis. Okay, so all these different rat tails. Okay, so that's hypothyroidism. It's a one differential for symmetrical alopecia. Then we talked about Cushing, and we know that can be iatrogenic or endogenous. Now let's take a look at some of the clinical presentation. So again, it's a symmetrical alopecia that spares the head and the extremities. You may have the pot belly appearance or not, depending on how advanced they are in the condition. They simply just progressively develop this poor quality hair coat because cortisol interferes with the anagen phase of the hair growth. So they eventually kind of like grow less and less coat. Of course, we talked about all the other systemic signs of Cushing, but skin-wise, thinner skin, comedones, possibly calcinosis cutis, hyperpigmentation. In my experience, they also at some point develop Demodex. So if you have the classic patient is a middle-aged Shih Tzu that basically develops demodicosis as an adult onset demodicosis. So it's very important when you're presented with these cases, yes, it is Cushing, but also never forget to scrape these dogs because they may have multiple diseases. Okay, so a few more examples, so those are kind of like easy to kind of guess. You have Cushing, you have all the signs, so poor quality on the truncal. The one on the right has also thinner skin. Typically the vessels become more prominent. This is a dog that had Demodex, and it was treated by the local vet with steroids. I'm not sure why. I think because initially responded to steroids, and so many things get better with steroids, and I think that actually brings me to a comment. There are many things that temporarily look better with steroids. That is not a diagnostic test for allergy. So, but this dog stayed on steroids. It was never scraped until eventually came to the university. But I don't know if he had Demodex all along or he developed Demodex later, but he was a Demodex dog that obviously had iatrogenic Cushing. And then you have dogs that naturally get Cushing, Bostons are prone to it. And again, thin skin, comedones, calcinosis cutis in the inguinal area, axillary area. So to kind of refresh our memory, when I see comedones, the things that I think in my head are Demodex, endocrine diseases, and actinic damage. Those are like three important categories of differential diagnosis. Anytime you see comedones, and then you rank them based on other clinical signs that you see in your patient. Calcinosis cutis is sadly common in some of these cases. I'm not sure why bulldogs, in my experience, are prone to it, but Boston Terriers can get it too. The dorsal area is commonly affected, and it starts with white, little, hard, papular lesions, and then they all coalesce and they create this like thick, almost like a plate, and so the whole area becomes calcified. Very pruritic. Very pruritic. That's why it's very important to kind of like when they start, and they, don't always think, oh, I need more steroids to control this. You need to consider the possibility that it's coming down with calcinosis cutis. In the clinics, we use DMSO to try to reabsorb some of these lesions. So of course, a case like this, it will never go back to normal, but if you catch them early and they can do topical DMSO, is a way to reabsorb the calcium, okay? So those are like the two big endocrine diseases that we see. But we can also see other cases that look like Cushing but is not. And one is this Alopecia X. And so Alopecia X has received multiple names over time, I think largely because we don't, for the longest time, we really did not understand the pathogenesis of this disease. But basically, this is a sex hormone imbalance in dogs. They may be neutered or not, but the sex hormones are from the adrenal glands. And so they may look like Cushingoid dogs, but they don't have Cushing. If you do an ACTH stem and you look at the cortisol before and after, is not changed as you would expect in a Cushing dog. There is a definite breed predilection, so Pomeranians are overrepresented, but I have seen it in other breeds of dogs as well. So they look like they have Cushing, but they don't. Their skin is not thinner. They don't have PUPD, and it's not that they eventually progress into Cushing. At times people were concerned that Alopecia X is the first step toward Cushing, but it doesn't seem to be the case. So the alopecia is truncal, and it spares the head and the legs, just like the previous cases I showed you. Some of them have hyperpigmentation, and I'm not sure whether they get a tan just because they're bald or because of the disease itself. I've seen it both ways, whether the disease itself leads to hyperpigmentation. Okay? So they are systemically healthy, but it's typically distressing to owners because they, of course, got those dogs because they like the thick, fluffy coat, and so to have a dog that doesn't have that is typically an issue for many of these owners. Like I said, I have seen it in other breeds of dogs, so I think it's important for us to be open-minded. Of course, there are some breeds where we think of some differential diagnosis more likely, but we do need to stay open-minded. Again, the hair loss may be partial or complete, depending on how far along the disease has gone. And so different breeds. This is a Yorkie, so this is not a Pomeranian. So you can have in multiple breeds, but the one thing in my experience, very few of them have skin infections. I've seen some that eventually develop yeast, but the vast majority just are bald, and they're non-pruritic. A few get infections, and they may become pruritic, but this is a difference between, let's say, the Cushing dog and the Alopecia X dog. The Cushing dog typically does get an infection. They get skin infections and urinary tract infection. The Alopecia X dog typically does not have infections. And you can see that the skin does not look inflamed. It's just basically bald. Okay, so all different examples of dogs with that. Okay, so this one had a little bit of pyoderma, right? So that you can see that the skin, it starts to look more like active, has some scabs, and it's not this nice uniform hair loss. Okay, but this one is basically just hypotrichosis and no infection at all. Okay, so how do we manage these cases? So first, I think it's good to make sure that we rule out the basics. So I think, depending on how financially strapped people are, I think it would be good to do some basic blood work to see if there's any indication for anything. And I would start with CBC chemistry to see if there's any change. We learn about the cholesterol, triglycerides, and and things like this. But then eventually the test to diagnose it is an CTH stem. And it's a CTH stimulation test, which in the US we submitted to Tennessee. I have no idea what it would be here. But basically, they provide a sex hormone panel besides cortisol, and you basically measure sex hormones before and after a CTH stimulation. And basically, that allows you to test the plasticity of the adrenal glands to basically produce sex hormones under stimulation. And many of these dogs have increased progesterone and testosterone after stimulation. Okay, so those are the 17-hydroxyprogesterone and androstenedione. Those are frequently elevated. My suggestion, if the animal is not neutered, I always encourage them to neuter the animal. And there are some animals that, although this is a disease of the adrenal glands, there are some cases that do respond to just neutering, okay? So that is typically the very first thing that I encourage them to do. Plus, you will not be using these dogs for breeding anyway. So I think that it's kind of like a safe recommendation. In the past, people would use growth hormone as a treatment. Matter of fact, this disease went in the literature under the name growth hormone responsive dermatosis, also called castration responsive dermatosis, basically, but it is always the same disease. So we don't use growth hormone anymore because of the potential side effects. So this disease is largely a cosmetic disease. So when we prescribe a treatment, my first indication is to basically do no harm if I can help it. So melatonin is reported in the literature to help some of these dogs. And so I think that's a kind of like a benign thing to offer. And then microneedling has been reported in the literature to help. And that comes from the observation that when you biopsy these dogs, the area where you have done your biopsy is where the hair will grow back. So it's kind of the inflammation caused by the fact that you did that kind of biopsy is what triggers the new hair growth. So people have taken this concept further, and they do microneedling to stimulate hair growth. I personally do this under general anesthesia because it's like the whole, it's a large body surface, and we go a little bit deeper than the microneedling that people would do for cosmetic purposes on their face. So they're all, in my cases, they're under general anesthesia. And I've seen some that respond and some that don't. But I think if people absolutely want to have option, I think that this is a fairly benign thing to offer. Of course, we want to make sure we do chlorhexidine baths before that, because you don't want to do all this macroneedling, and if they have bacteria that you drive it and then they wake up with a folliculitis and then you have a pyoderma. So there are people that have also used trilostane for this disease. I personally don't recommend it. I discourage people from doing a treatment that has more potential adverse effects than the disease itself. I encourage them to buy a t-shirt, okay? But I think that different people have different expectations, and these are the things that you can kind of offer. But the microneedling is reported in the literature. And I think that there are some dogs that definitely have benefited from it. And so it's something to offer. Moving to a different disease, Sertoli cell tumor. It's something that you will see in intact animals. Many times they're cryptorchid, sometimes not, but these are animals that have developed a tumor, and so that produces estrogens, so they have changes consistent with increased presence of estrogens. And skin-wise, they develop the symmetric alopecia, they may have seborrhea, they do have gynecomastia, and then they have this linear preputial dermatosis that is kind of pathognomonic of this disease. So if you see a male dog that has this, and I've seen it in dogs that were, quote, neutered, but basically they were cryptorchid, and somehow they, people, when they adopted the dog, they had no awareness that that was the case. And so you have to then look for a testicle and abdominal testicles that has gone neoplastic. But those are the telling signs. So gynecomastia, symmetric alopecia, and then you have this linear preputial dermatosis. So this kind of line that it kind of like goes like this. So this is something to consider. I mean, it's basically there are no other differential diagnosis for this presentation, so I think it's a fairly easy diagnosis. Then you have other options for why animals, quote, blow their coat. So you have anagen or telogen effluvium. What are those? So they are all linked to some illness or stress. The difference between the anagen effluvium and the telogen is the timing. So the anagen effluvium occurs within a few days from whatever illness they have had, okay? And they just people completely lose all their hair, but we see this in dogs. But dogs most of the time get telogen effluvium. And so any time that they're being severely ill or stressed or something that has affected them, all the hair goes into catagen and then telogen. Okay, so telogen is the resting phase of the hair growth, and so they blow their coat typically within a month or two after the illness. So you have these dogs that come, and the owner, and it's typically on both sides. It may start in patches, but then eventually can be just the whole body. And the skin doesn't have any lesions, and owners have no awareness of why this is happening. Again, due process, you want to make sure that you're not missing Demodex, that you're not missing an infection. But the skin looks beautiful, it's just bald. Okay? So those are the kind of things to consider. In my experience, it spares the head and the legs. It's typically the sides. Okay? Actually, right now, one of my dogs is going telogen effluvium. Okay, and so I just got the results of the biopsy. And so one of my other dog died 2 months ago, and I didn't realize that this has affected her this much, and she completely blew her coat. So in my experience, again, it spares the head and the legs, but it's both sides. It may start patchy, but then eventually becomes the whole area. Now, we're moving to a different way of developing alopecia, which is follicular dysplasia. Okay? So follicular dysplasia is something that runs in certain breeds. The Portuguese water dog is kind of like well described in the literature. The curly-coated retriever, the Irish water spaniels, those are all dogs that are being reported to have that. It runs in family because it's kind of like considered like a genetically inherited predisposition. In the literature, there are some articles that have reported that some of these dogs may have sex hormone imbalances, but I think it's kind of like a controversial thing because not everyone seems to have that. So most people accept the fact that the alopecia is not due to a sex hormone imbalance, but is due to a dysplasia of the hair. And they kind of like have thinning or hair loss on typically like on their flanks and sometimes the back of their legs. Okay, but the dorsal and sides, that's kind of like a classic, you know, and the back of the thighs. And so how do we approach this case? As well, the breed increases your index of suspicion, the distribution of the lesions, and then in order to have a final diagnosis, we do take a biopsy. And so basically you have this atrophy of the hair follicles, and some they can become completely miniaturized. So you may come across some of these cases, so kind of keep it in the back of your mind. But so that's one possibility. Then you have pattern baldness. And so pattern baldness is other breeds of dogs, greyhounds, for example, but dachshunds and others, where basically they can have this thinning of the hair or complete lack of hair in specific body location. So again, the back of the thighs, many times on the ventral chest, sometimes on the side of the head, and you know, we're basically, and it's normal for that individual. So it's not anything that is pathological, it's who they are, it cannot be changed, there is no treatment for that. It's just a feature, some individuals in this breeds. Now, another way to have hair loss is this dysplasia that is considered to be cyclic in nature. So we already talked a little bit about seasonal flank alopecia when we were talking about changes of pigmentation. Now we're talking again as a differential diagnosis for symmetric alopecia that occurs on a seasonal basis for some individuals in the shorter days of the year. There is some breed predilection, like bulldogs, boxers. Those are kind of like very prone to that. And these animals are otherwise happy, healthy dogs, no systemic signs, but they just lose their hair and they develop this hyperpigmentation. It's typically both sides, it's typically on the flanks, and in some individuals they can regrow the hair, and some is kind of just stays that way. Melatonin, once again, is kind of like a benign thing to offer as an option for these clients if they want to do something. Okay, so, but again, if I am presented with a dog like this, it's very important not to jump to conclusion, right? You want to do your due process, reach for a scalpel blade, do the deep skin scraping, do a fungal culture, do your cytology, ask if it's itchy, non-itchy, you know, if they want to do some blood work to see if there's anything else that points toward an endocrine disease or not. But you may come to the conclusion that it's seasonal flank alopecia. Another differential diagnosis is color dilution alopecia. So this runs in breeds that have color dilution, look like the silver gray color or the fawn colors. People love this kind of diluted colors, which are beautiful, but they have some downsides. And so the reason that these dogs are color diluted is that they have clumping in the cortex of their hair. And this clumping makes the hair very fragile. I'm going to show you some images. So you can have milder cases like this where you just have some clumping, but the cortex itself is still pretty intact. Or you can have some that are more severe, right? So if you have a dog, so you can range for something like this, not too bad, or you can have something like this. So the more the clumping you have, the more this hair is going to be fragile. And so it's going to one, break on his own, so very important that we use mild moisturizing products and nothing harsh and so on. But also they're going to be prone to bacterial infection because that cortex doesn't have much protection. Okay, so this is kind of like a different severity of cases. So this is a very easy diagnosis that you can make, just plucking some hair and looking under the microscope. And these dogs will come to you because they develop recurrent pyoderma. And once again, it's typically the trunk that is affected, so it spares the head and the extremities. And so you are basically routinely treating these dogs for pyoderma. And while we say you should not use antibiotics, you should do topical therapy to kill Staphylococcus, which is all true. But you need to be very mindful for these dogs, because if you start using too much benzoyl peroxide or too much chlorhexidine, which are very drying, then you're gonna damage the hair even more. So I think it's important when you see these dogs as puppy coming to you to kind of like educate people to say, congratulations, you got a beautiful puppy. I said, but let me tell you, it's very important that you use a lot of humectant moisturizers and so on, because this coat is a high maintenance coat. And so that you kind of prevent new bouts of pyoderma all the time. Okay, so fawn dogs can also get that. So this is color dilution. Okay, so you're going to see some of these cases, I'm sure. If you're not sure, you can take a biopsy where you can basically visualize the distortion within the hair follicle. And so again, these dogs are very prone to recurrent bacterial infections. Okay, so I know you have many different products available to you, but you have fatty acids, probably shampoo, spot-on, mousses, spray. In the US, we use alpha carry oil, which is a moisturizing oil that people use after a shower, that you can basically spray on the coat of these dogs to provide some moisture. That we have ceramide products, whatever you have available to you, but it's very important that you provide some moisture to the coat of these dogs. But it's not just the diluted dogs that get this. You can also have black hair follicle dysplasia. So there are some dogs that they can get this issue in the black area. Okay, so it's kind of like considered like a less severe variant of the color dilution alopecia. It runs in families, considered like an inherited disease. And again, these dogs that have this poor quality, dry coat, and it can occur in a variety of breeds, and they get this recurrent pyoderma. So once again, it's important to pluck some hair and kind of look and see if you have any evidence of melanin clumping. So there are cases reported in the literature where basically they can start at a very young age. And so just keep in the back of your mind, particularly if they keep coming back with recurrent infections. So you don't need to have an allergy to do this. This is just who you are, and so it's just damage control long term. Then you can have post-clipping alopecia. There are some breeds of dogs where you need to be very careful if you clip them. The other day at the workshop, we had a husky. Okay, that's prime example. If you clip a husky, let's say you're doing a spay or whatever, you need to let the owner know that it might be a year or two before the hair comes back, because they go in catagen arrest, and that's just normal for some breeds of dogs. And so it takes forever until they get the new hair cycle to grow their hair back. And so that's not really a disease per se, it's just something to be aware. And then you can have dogs that don't grow their coat back after clipping, maybe because they are hypothyroid. And so that's something, maybe low grade. So something to consider. If they come back for a recheck and they say, hey, that patch is still bald, that maybe you can consider looking for thyroid levels. So to summarize, we have looked at different options for which dogs and cats can develop symmetrical alopecia. It's very important, first and foremost, to ask ourselves, is this self-inflicted or not? If you rule out the fact that the animal is not pulling the hair out, then your options are, a disease of the hair follicle cycle, maybe due to endocrine diseases, dysplasia, or choroidal dilution. So again, it's very important to take your history, your physical exam, look at, the individual that you have in front, the breed, so that you can rank your differential diagnosis, and always due process. Rule out the common things first before you get to the weird stuff. And the dysplasia cases will eventually require a biopsy. But there are many things that you can diagnose just based on history and physical exam and just general assessment of the risk of that patient. So this is what I had for you on symmetrical alopecia. I have no idea of time, so am I... Okay, perfect. Yes, I see a hand. Hi.
Hello.
Yes.
There were two Indian women. One got Miss Universe and one got Miss World awards. So after that, what happened? There were a lot of beauty parlors opened all over India. The same, now we have got more pet shops than veterinary clinics all over India, and parlors where any dog comes, immediately they'll cut the hair. So my question is, if any dog that comes, if the hair is cut, whether it is mottled or any skin infection, okay, we cut that part. But here what they are doing, they are just trimming to earn money. So what is the effect if all the dogs' hair cuts, and what is going to happen?
The effect of grooming?
Yeah, grooming.
Yeah, so I think it's very important to be gentle in doing that. So in my experience, and many times there's some breeds of dogs where they do the stripping, that is not even the clipping. That is a certain recipe to get bacterial infection afterwards. Or if they are too aggressive with the clippers, that basically you induce this micro trauma on the skin, and since the bacteria are always there, it becomes a port of entry for the development of an infection. So I think it's important when people take their dogs to be groomed, to have somebody that is gentle, that it doesn't pull on the hair and it doesn't damage the skin, because otherwise, in my experience, that's what happens. They all come down with folliculitis afterwards. And they may not have any other underlying disease other than the fact that it's a man-made skin trauma. I don't know if that answered your question, but...
Good morning.
Yes.
Hi. So I just wanted to ask, I have recently...
there's something in the history, some kind of stressful event, and then the blowing of the coat. So I don't know the sequence of events for your case.
They have a small history that the dogs were kept in kennels.
Okay.
For a few days, okay. And they came back. But they cannot give the exact timeline when the alopecia started.
Right.
That is one history I didn't.
Right. So the telogen effluvium dog will resolve on his own. It's just that basically they need to recover from that episode. So it could be the stress of being boarded. Right? Yeah. I misunderstood. I didn't realize that you were asking about telogen effluvium.
Yeah, I noticed that too. You did hear. It's just one thing you suggested eventually a biopsy. And I'll go back a little bit. Considering the breed, the pattern, I think alopecia X is high there.
Yes.
Right? Because in the telogen effluvium, actually, when you biopsy, the hair follicle will be pretty much normal. And so, because it won't be intelligent at the time you biopsy, because the hair falls off because it's, that she said 1 to 3 months after a stressful event. It's when the hairs are now in anagen and a new hair is growing. So in alopecia X, then there are definitely abnormal findings.